Hello, my name is Jennifer Gaudet and I'm a nurse practitioner and I own Everyday Wellness located right here in Wichita, Kansas. And today I'd like to teach you how to draw up your GLP-1. Really, it's any kind of medicine. So we're going to learn how to draw up injections today. So what you're going to want to do is have some alcohol swabs, your vial of medicine, and your insulin syringe. So first step, always wash hands. So we're going to assume we have washed our hands here. And then we are going to get to the good stuff. Okay, so this is just a vial of water. I've dyed it blue so we can see it a little bit more easily. So we're going to take our alcohol swab. And then we clean the hub. This little rubber piece here is called the hub. When you first receive your medication, it's going to have a plastic coin covering it. So you basically just kind of flick that off and it goes in the trash. And then it doesn't go back on. This is what you're looking at. So again, we're going to always clean the hub with an alcohol swab. Then what we're going to do is get our syringe. I like to pull down the syringe with air, the amount that we want to inject. So let's just assume we are doing 40 units, okay? So that's what that looks like on that syringe. We always measure at the top of this black stopper here. And what you'll do at that point is pull the cap off. It is a very, very small insulin needle there. These needles, the biggest problem I have with them is that the needles are so fine that they tend to bend easily. So what you're going to want to do is aim for the center of that rubber hub, and I like to do a little twist and push down at the same time. You are going to push your plunger down and put the air inside of that vial. At that point, you're going to tip it upside down. So we will do that together. We got this. And then there's really no wrong way to do it at this point. You can pull it down like this. You can hold it like this and pull it down, whatever you want. But I tell people, this is like, everyone is so anxious about drawing up meds. It's not normal to be playing with needles, right? So, I've been a nurse for a very long time. I feel like I can do this in my sleep, but I promise you after a few injections, you will be able to as well. So I tell everybody, flip it upside down. That sucker is not coming out of there. No issues there. I like to, and again, this is blue just so we can see it a little bit easier, but you want to pull down, and I like to pull down more than what I need. So if I want to do 40 today, right now I'm sitting at about 70 units, if you can see that. And I do that because to get rid of the air bubbles. Now, air bubbles are never going to hurt you when we're dealing with a 1 ml syringe. It takes at least, I think, 10 mLs of air to create an actual air bubble. And this is going nowhere near your arteries or veins because this is going to be going into your fat layer anyway. So I only tell my clients to be careful of air bubbles because when we start weight loss shots, oftentimes your dose is going to be about that much, and that's a really small amount of medicine. So if you have a big fat air bubble in there, you're going to rob yourself of half your dose sometimes. So that's the only reason why we talk about air bubbles in this setting anyway. So again, I'm going to pull down past 40 units. Okay, and then what I do at that point is I like to hold it in one hand and then I flick it. That way, if there are any air bubbles in there, they're gonna all rise to the top here. And then at that point, I can kind of push them back up into the vial. And now I have my 40 units. So if you can see that, that is where I want to be. And then we are ready to go. So I tell everybody, leave your syringes in there and you can just pull it out of there when you're ready to inject. If you are pre-drawing your syringe and you're not ready to poke yourself, you're just getting it ready for later or another day, then you're gonna recap that guy. So you can do this. If you are shaky maybe, I would recommend putting the cap down on the table and then you can go do this and not poke yourself. You just never want to put it down on the table like this. It's pretty self-explanatory, but again, maybe is not common knowledge when you guys are not used to doing injections at home. So that would make your needle dirty. This needle is going inside of your body, so we need to keep this clean at all times. So at this point, our injection is ready to go. Let's talk about where are we poking ourselves. So there are 3 spots that are recommended. Basically, you can inject it anywhere where you're a little fluffy and you have some fat there, but you're gonna go for 3 sites. You're gonna go around your belly button, under the arm, or on your leg. So my favorite spot, especially for my GLP-1s, is the abdomen. So what you wanna do is find your belly button. Mine is here. So you wanna go 2 finger lengths below that, or off to the side. So I usually say, okay, this is my spot here. This is a great spot for GLP-1s because if you're on a GLP-1 medication, you got real estate here. So you got fat that we can squeeze in this area. So my belly button is here, 2 finger lengths. So I'm gonna go off to either side. So we're gonna go either inject this way or over here. I like to go left or right, that way we can alternate. You should always alternate your injections because if you always hit the same spot over and over and over again, you'll develop a little bit of a callus. So I like to alternate left and right every week. If you want to do your arm, we are aiming for the bat wing. So right here where our flabs like to flap in the wind, that's what we are aiming for, okay? Because it's not a traditional intramuscular shot here like a flu shot would be that most of us are accustomed to. It's going to our fat. So I tell people, really, this is difficult to do by yourself. I have one client where, bless her heart, she goes up against the wall and holds it that way and does this. You don't have to do that, okay? We have lots of fat on our body. We have other body areas to choose from. So if you have a partner, the underarm area is a good spot. You'll have your friend or partner, whoever, do that. But what you'll do is you'll kind of pinch an inch down here and you'll be injecting in this area here. If you want to do your thigh, then I tell people to kind of get your hip and your knee and about halfway in between. That's where you're gonna aim for. I like to do this when I'm sitting down because when I'm standing, I tend to tense and create a muscle, and we don't want that. We want nice flabby areas. So I like to just kind of sit down and poke like this. You can do the top. We're not going for muscle here. So if you're doing the top of your thighs, make sure you give them a nice little squeeze and get that fat away from the muscle there. So side here, top here. I tell everybody to pinch an inch. So you want to really stabilize that fat. If you're doing your belly, then you're going to do a nice pinch here. That way the needle is nice and sharp. It'll puncture pretty easily. One time I didn't hold my fat when I did my injection because I'm also on these shots. I just went to poke myself and it just kind of went in and in and in and in and finally poked through because it's, our fat is nice and soft, so we want to stabilize it. So you pinch an inch, you're going to get a new alcohol swab and you're going to clean the area. Once you clean that area, it's nice and clean, then you're going to get your injection and it's going to go in at a 90-degree angle, so it should look perpendicular. Some injections should be this way. For our GLP-1s, it should go straight in. So you're going to pinch your inch, you've cleaned with alcohol, and you're going to go straight in. Once your needle is in, you're going to push your plunger down all the way. Most of these medications, if you're on a compound, are going to be mixed with B12, which is going to make them pink or red in color. That makes it very easy to inject because you can see it much more easily. So basically what you're going to do is you're going to press your plunger all the way down. You're going to put all that medicine in. So I'm just going to squeeze it out on the table here to get rid of it. Okay, so now we've injected it, all that's gone. You take that out of your belly or wherever you've injected, and then I usually like to just kind of throw my shirt down when I'm done, and I like to massage it in, and that just kind of helps get it absorbed and working so it doesn't kind of just sit there with gravity. So very, very easy stuff. Almost every single one of my clients has been nervous to do this, and then after they actually poke themselves, they all say, that was so easy, I didn't even feel it. So I promise you, if you're nervous, totally normal. After a few shots, you'll be able to do it in your sleep as well. Thanks so much for watching.